2015 is when I retired, and then when I came down here, the back just kept getting progressively worse. My quality of life was, I was suffering big time.
Suffering big time for Mario meant he was feeling such a loss of life. Even simple things were painful. And as we now know, persistent pain over time can lead to bouts of depression.
I was really depressed because you're used to being able to do something and you can't do it. Things are being taken away from you. Doing simple tasks like getting up and down a chair, things that people take for granted, I wasn't able to do. And used to being physically fit, lift weights, shooting guns, and living life, and I couldn't live life.
It's bad enough to live with back and neck pain for a long time, but it can get worse. And that can lead to a cycle of pain to depression, where the depression leads to more pain, and more pain leads to more depression. However, the physicians at Southeastern Spine understand the importance of breaking a patient's pain cycle as quickly as possible, because so often people have already been suffering a very long time before they come in.
On the very first visit, I met with Dr. Anderson. He took an x-ray of my back and he said, well, here's your problem right here. It was all elementary. I mean, it was right there. And from that very first visit, I had a ray of hope that, hey, this was going to get better.
Helping people get better is why the Southeastern Spine Institute has everything under one roof. Here you'll find the latest medical procedures for back or neck pain, plus the experience of many physicians in all areas of spine medicine who, working together, can provide the latest spine treatments for your specific issue.
One of the things that's great about our practice is that we have multiple different specialties under one roof, including physical therapy, rehab, pain management, and surgeons.
Sometimes patients give up on any treatment option, believing that, okay, my back gotten older and there's nothing we can do.
Big, but definitely enough to cause or potentially cause some of your symptoms.
But there are several treatments available, so it's always worth getting expert opinion on that subject.
We're here to treat you using the least invasive techniques, hopefully to give you the best result without having to undergo any further intervention.
Over 90% of the people who come to Southeastern Spine find long-lasting pain relief without ever needing surgery. However, if because of a structural issue in the spine, surgery is required. Here you will also find the latest technologies and surgery procedures found anywhere in the country. So when it turned out an operation was the best course of action for Mario's condition, he was in the right place to have the latest modern surgery.
Mario was able to have his surgery done through a minimally invasive approach, and this small incision surgery allows for faster healing, a lower risk of infection, and an overall better outcome.
And after Mario's successful operation, his pain cycle was broken. He was no longer in pain or depressed. And he shared with us that he was so happy to have found the Southeastern Spine Institute right in his new hometown.
Well, number one, they took care of me, and number two, they're in my own backyard. They're here in South Carolina, and proof is in the pudding. I feel good.
The minimally invasive approach we used with Mario allowed him to get back to doing the things that he loves to do during his retirement.
I'm doing what I want to do again. I'm lifting weights, I'm riding my bike, I enjoy shooting. I come here at least once a week, I shoot, and it's great to be able to come here. I feel like my old self. I love it.